people in Britain are less likely to survive treatable conditions such as breast cancer or strokes than those in other rich nations. This is a new landmark study. It was a review by the King's Fund linked to the issue of below-average funding for the NHS, resulting in a lack of equipment and staff. Well, let's speak to the Minister for Social Care, Helen Whately, to learn more about this. Helen, good morning to you. You know what?
Good morning.
We could start with the negative stuff, but I don't want to start with the negative stuff. I want to start with the positive stuff, because here we are, we're in this 75th birthday year for the NHS, and you have a new initiative. We're talking about Sarah Ferguson in the papers today, doing well after her breast cancer operation because of early detection. And you, Minister, think you can do the same for lung cancer. Tell us how.
Yes, you're absolutely right. And I wish the Duchess of York well as she recovers from her breast cancer treatment. And actually it's wonderful that she's speaking about that experience and encouraging other people to go for breast screening when they're invited to do that. Because we know screening makes a huge difference to your prospects for having cancer detected early. And if cancer is picked up early, then the treatment is more likely to be effective. Today we're announcing the rollout of a national targeted lung cancer screening programme. The reason we're doing that is because lung cancer is one of the biggest killers. It kills around 35,000 people a year. The reason, very sad, it kills so many people is because too often, around 70% of the time, people's cancer is detected late, and if it's picked up late, the prospect of successful treatment, sadly, is much lower. What we know we do if we do targeted screening is then we can pick up the majority of cancers early. In fact, around 76% of the cancers then treated early, and then your treatment is much more likely to be effective, and that makes a huge difference to your survival rate from cancer. So we're going to be inviting people in for assessment and then screenings if they're at higher risk of lung cancer. Those invitations will be for people who are aged between 55 and 76, who are at higher, 74 rather, who are at higher risk of lung cancer, particularly, for instance, having a history of smoking. I should say, to reassure viewers, that actually most people who then are screened won't actually be diagnosed with lung cancer. It's only around 1 in 100 who get that diagnosis. But for those people who are diagnosed, that can make all the difference to your prospects for survival. So when you do get an invitation, it's really important to come forward for screening.
Minister, how intrusive is the testing? When you say you can test for lung cancer, how would you test? What will happen is people who are identified as at risk, for instance, because they have a history of smoking, will be invited, first of all, to have a phone call to assess their risk, and then for those who are indeed assessed as high risk, they will then be invited for a low-dose CT scan. It's a very quick scan. I'm told it will just take a few minutes, and then that is then subsequently reviewed, and for people that there might be a concern about, they're then invited in for further investigation. In fact, some people who are then invited in, what it will be is just keeping an eye on whether they might have seen some nodules in their lungs, might not necessarily be cancerous, but need to be kept an eye on. Other people will then start treatment for lung cancer. But what we know then is that if your lung cancer is detected early, that would then be the majority of people, at least 60% of people so are likely to then survive 5 years. That's much better than if it's detected late, when only around 4% of people survive 5 years.
Minister, I've got to ask you about the King's Fund report that was published this morning. It says that people in the UK are less likely to survive treatable conditions such as breast cancer and strokes here in the UK. I mean, that doesn't make for good reading, does it? That must cause you a lot of concern.
Of course it causes me concern to hear, and I will read that report when I get back to the office after these interviews and clearly look at it. But what is really important actually is that we take the steps we need to diagnose conditions like cancer early. We know that's the big thing that we need to do to improve outcomes. That's why we have our breast screening programme. That's why we're rolling out this targeted
lung cancer screening programme. It's why the NHS has been encouraging people to come forwards if they're worried that they might have symptoms of other cancers like bowel cancer, and since the pandemic a lot more people have been coming forward with concerns about that. And the NHS has actually been doing a really good job at faster than ever before, either diagnosing or giving people the all clear, and for the first time ever reaching what's called our faster diagnosis standard on that, because it's really important to get the diagnosis quickly so then people can move forwards to treatment. But really focusing on faster diagnosis and then enabling treatment is part of what we need to do to help the NHS for the next 75 years indeed. The other thing the government's going to be doing this week as we celebrate 75 years of our National Health Service is announcing our long-term workforce plan. This is a historic thing for a government to do. It's never been done before. It's planning ahead for the future needs over the long term of the NHS workforce to make sure that we've got the doctors, nurses and healthcare professionals we need to secure the future of our National Health Service.
Yeah, we're going to hear more from Rishi Sunak this week, as you say, on that 15-year workforce plan. But how is Rishi Sunak planning to get more doctors and nurses through the door when we haven't got any money to give them?
Well, actually, at the moment, we are spending record amounts on our National Health Service. We're spending around £150 billion a year. The NHS has given at the last budget an extra 14 million for healthcare over the next 2 years. We know that there are these huge pressures on our National Health Service, so that's why we're putting in extra investment to help it recover from the pandemic, which of course was very tough for the NHS, tough for doctors, nurses, other health professionals at the front line, and has meant that we have many people who didn't receive treatment during that time now waiting for treatment. One of the Prime Minister's five priorities, is to cut those NHS waiting lists, and the NHS is making progress on that. The NHS has virtually eliminated people waiting over 2 years for treatment last year, and this year has virtually eliminated people waiting over 18 months, so bringing down the long waits that we've seen develop since the pandemic. And then moving through into next year, we expect to be able to actually bring down the numbers waiting altogether. We know that's really, really important to people, not to have to wait for treatment.
Minister, thank you very much indeed. Thank you, and happy 75th birthday, not you personally, but the NHS, of course. And Helen Whately is the Minister for Social Care. Thank you for your time this morning.